Hello again, and welcome to another Moment with Dr. Salibi. Today I'm going to talk about one of my favorite subjects, hypothyroidism, and best management options. Since 1999, hypothyroidism has been a special area of interest in my current practice, and I have spent a lot of time researching and reading and going to conferences to address this disorder that affects more women than men and is poorly managed by conventional medicine. Unfortunately, most women, even seeing board-certified endocrinologists, are not managed appropriately, and they feel it, even though they're told their numbers are normal. So in this short podcast, I'm going to talk about appropriate management, and we'll start with a history and testing. About 80% of the diagnosis of hypo or even hyperthyroidism can be ascertained by a very detailed history and physical examination. Laboratory testing should follow. Today, a TSH and a T4 are just not enough, although that's what's mostly prescribed these days. T3 uptake and thyroxine index are useless in my opinion, where they should be substituted for appropriate testing like free T4, which is the unbound total T4, and free T3, which is the unbound T3 hormone, which is the active hormone. Reverse T3 is very helpful often in folks that are poor T4 to T3 converters. And measuring TPO antibody titers and thyroglobulin antibody titers are important. When a problem is more of hyperthyroidism like Graves' disease, a TSI should be done. Other things I test for are CTX, which is a bone turnover marker, mostly during management, so we know we're not overshooting their therapy. Cortisol mapping using saliva cortisol samplings 4 times throughout the day, and something called a CAR protocol is helpful. DHEA sulfate is another test we often do, and a more comprehensive sex hormone analysis looking at the whole HPA axis. I also run homocysteine on folks to make sure they're methylating very well. A CDSA, comprehensive diagnostic stool analysis, is also a way to ensure that the gut is working correctly and there's no gastric permeability issues. And I round it off with measuring several inflammatory markers. We can also look at what Dr. E. Dennis Wilson and Dr. Broda Barnes have done in their research using basal body temperature and heart rate indicators for assessment and management of hypothyroidism. And the subjective assessment, listening to our patients, not just getting hung up with lab values for the management of hypothyroidism. Options for therapy, most folks in the world are being prescribed Synthroid, which is a T4 only therapy. It is one of the most prescribed drugs in the world and has been for decades, but is not necessarily the best option for the vast majority of patients. Natural desiccated thyroid, or NDT, which is a combination of T4 and T3 hormone, is in sort of a natural ratio and is bioidentical. And that is what my practice tends to prescribe much more of. Occasionally, we have some folks that are very poor T4 to T3 converters, and they require T3 only therapy, either in the immediate or sustained release form. Similar to Cytomel, although Cytomel brand name has gluten, so we usually opt for generic non-gluten containing preparations. Supplementation with iodine, selenium, and some herbals such as ashwagandha and bladderwhack, and a few others to help with thyroid health are prescribed when deemed appropriate. Paramount for the best treatment of hypothyroidism is required education by the provider and also the patient. One of the books that I authored a chapter in on NDT, chapter 3, and Stop the Thyroid Madness, second edition, is available on Amazon and Barnes & Noble. The disease prevention and treatment put out by Life Extension Foundation, I did a chapter on stress management in there that has some helpful information on HPA axis, which includes the thyroid. And back in 2006, I published a book on adaptogen herbs, wonder herbs. I mentioned 3 of the about 25 or so known adaptogens. That is very helpful in the management of adrenal issues and thyroid issues in some of our patients. Also, attending a functional medicine symposium. If you want more information on upcoming events, please email us. Currently, our 2020 event will be mid-July, and the URL for that is tinyurl.com/DOL-2020 for ticket and other information. This is open to providers as well as to the general public. For more information on how we manage and test for thyroid disorders, please call our office. It's 800-965-8482. You can email us and check out our website, carolinaholisticmedicine.com, for best management options for hypothyroidism and other thyroid disorders.